Braces. They bring in a lot of confidence, and we all are definitely very much excited when the braces are going to come off and when we will be able to see that new sparkling straightened smile. But unfortunately, when the braces came off, what did we land up into? The white spot lesions. What are these? When the braces get off, you can see certain areas on the teeth surface where there are white spots, and these spots are very much prominently seen. What can we do? Or the question is, why have these spots arisen? So friends, today we are going to discuss on why do these white spot lesions come up, and also how can we treat them. So come, let us have a look at today's video.
Subscribe to my channel Dr. Mansi Shah to get dental tips.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, today as we are discussing on this white spot lesions, you can see these white spots very prominently in children, especially if you have very clearly observed that whenever there are small children and they have a lot of sugar or a lot of caries, then white spots can easily be noticed in their mouth. So what does this white spot indicate? Yes, they indicate the beginning of the caries or cavities in your mouth. So early carious lesion is a white spot lesion that is seen. So as now you have understood why has this white spot lesion really been there, now let us know how are they there. So what are the reasons why this white spot lesions arise? So friends, it is nothing but simple terms, I will say demineralization of your tooth that is taking place by an acid. Demineralization, acid, oh my god, where has this come from? So as we know that our tooth is made up of minerals. The enamel, dentin are the layers of the teeth which are made up of minerals. So on this, if there is an action of an acid, there is demineralization, that is the minerals of the teeth, they get removed from their structure. They get eroded. So why does this happen? It is because of the action of an acid. And why does this acid, or where does this acid come from? So this acid basically comes from your food. And how is this formed? So bacteria in the mouth, the good and the bad ones, all are present in your mouth always. So bacteria in your mouth, they react with the food, and that leads in the production of an acid. Food, to be specific, the sugars or the carbohydrates. So they lead to the production of an acid, and this acid causes demineralization. But how does food and bacteria that is always present? So why particularly when caries are starting, or why when I am having braces, that time only this reaction has happened? Because food, I am always having, bacteria as I said are always present. It is when that it has been studied that for a particular time period, if you are not keeping your oral hygiene properly or some food is getting stuck, that is the time when the bacteria get their time to act on your food, break it down and lead to the production of acid. So now let us know when all can these situations happen. First, as I said, food is getting stuck or lodged on the braces on your tooth and you are not cleaning that stuck food. So now as you know that metal braces or ceramic braces, they have some components. They are pointed, they have wires. Now in between, behind or everywhere, you should be cleaning your braces. But are you really doing it? Your dentist has recommended you certain things, but you're not maintaining it properly. So food getting stuck, not properly maintaining, not properly brushing your tooth. That is, your dentist has recommended you use a floss, interdental brush, and of course your normal brush. You also get orthodontic brushes in the market. So not using all of this and allowing the food to get lodged there, it is going to cause the food and the bacteria to react. Then comes eating a lot of hard, sweet and sticky food. The sweet and the sticky food, of course, has tendency to stay much more on your braces. Hence your dentist recommends you that after you eat some sweet or sticky food, brush immediately, and the brushing has to be very much properly done. Then using mouthwashes, because that would also reduce the activity of the bacteria. Then the last one is drinking soda or sugar containing beverages, because you think that it is just water or it is just a drink, and how does there is no contact of any food with the bacteria. But all these drinks have sugar in them, and sugar is going to cause cavities. So I'm not saying that you restrict yourself from eating, but properly maintaining and brushing is very much important to avoid this situation. Now friends, remember, the bacteria are always ready in the attack state. If you are eating something and not maintaining hygiene, then they are going to react and cause demineralization of your teeth by production of an acid. So this is how these white spots are nothing but an initial start of the cavities or caries. Also, this white spot sometimes can be misunderstood for plaque and calculus. That is also not good to be there. But yes, if that is the condition, you can see some yellowing or white lumps formed on your tooth, then they can be plaque and calculus. So now this plaque and calculus can also lead to this white spots and cavities and caries. So if you have not been maintaining your braces, that is the reason why you can see these white spots. Now, is it something so much to worry about? Because these white spots are very much prominently seen. Okay, I'll tell you why are these white spots prominently seen. It is because of the optical illusion. Whenever there is transmission of light, these white spots, they have no minerals in them. So there is no reflection that is happening. And that area is seen prominently or opaque. Whereas your other tooth, that is quite translucent and it does reflect light. So hence these white spots are very much prominently observed by your friends and family members. Who is to be blamed? The dentist, the orthodontist? No, my friends, it is only you, because you have not been working on it. Now, is there no way to out of this? Am I just going to live with this white spots? I was expecting a white bright smile with a new straightened smile, a picture perfect smile. Now what? Should I just stay with it? No. A dentist can definitely help you out. Okay, so here we come to the remedies of this white spots on how and what can we do to it. So the first and the foremost thing, that sometimes these white spots are very much less in number or less in depth or less demineralization has happened. A simple remineralizing toothpaste, the one which has fluoride in it, that can be used. A dentist will definitely recommend you if a higher version is required. A remineralizing toothpaste with good maintenance is very much important. So a brushing, flossing and mouthwash use, all having fluoride in them, will help you sometimes to get rid of it. Second is scaling. As I said, plaque and calculus also lead to this white spot lesions. So on time, like during your braces treatment, also if you have started noticing these white spots, you can just visit your dentist and get a scaling or a cleaning treatment done. After your braces also, I do recommend it to all my patients. You have white spots, you don't have white spots, you have plaque, you don't have plaque, still have a cleaning procedure done, because that helps you to fight better the bacteria. First was brushing, second was cleaning. Now coming to the actual white spots, what can we do? The third comes into application of remineralization creams or pastes or some fluoride application treatment. So this can be done at office in your dental clinic, and this fluoride will help you to remineralize that demineralized area. Yes, that can definitely be done. Now, the next is microabrasion. What is that? That is, we do buffing or etching of that particular white spot area. Then, after that is done, we apply some strengthening material into it and change the shade of that particular region. So, microabrasions can be helpful. The next is having veneers or caps. That is, if the white spots are too large, you're not happy with it, then veneering, direct and indirect veneers, composites or caps can help you especially on the front teeth, they can help you to fight or cover up this white spots. Now, if you are really into doubt that what is this veneers and caps, you can watch the video. I'm sharing the link in the description section below, so do not forget to visit it. The next one is teeth whitening or dental bleaching. So what is this basically? That is application of whitening agents or a bleach like we apply to the skin. Similarly to the teeth, for whitening the shades of your teeth can be done. It can easily whiten all the shades of your teeth and mask up this white spots. So it is going to do a two-way benefit. It is a cosmetic procedure and it is going to be beneficial for you. So friends, this is how we can treat this white spots. You don't have to be sad and regret on the treatment or regret on what you have not done priorly, but we dentists can definitely help you out and fight this white spot lesions. If you have any other questions or remedies you have undergone for this white spots, do mention it in the comment section below, and I'm here to welcome all your comments. And if you have any questions, I'm here to answer it to them. Do not forget to like and share this video with as much as friends as possible, because right time maintenance can prevent this white spots. Yes, do not forget to subscribe to my channel Dr. Mansi Shah. Press the bell icon so whenever I post a video, you will be notified about it. Till then, I'm wishing you a healthy and happy brace life. That is, wishing you a good maintenance and a great smile. Be healthy and be over fit. Thank you.